Welcome to the Explainer. So we're kicking things off today with a question that sounds simple, but is actually pretty profound. Does stress actually make you physically sick? It's a phrase we throw around constantly. I'm worried sick, or this job is literally killing me. But is there concrete, measurable truth to that?
Well, the short answer? Absolutely yes. But the how and the why, that's going to completely change how you view your daily grind. Today we're unpacking the hard data together. We're going to look at the hidden mechanisms that link your environment, your work, and your physical body.
Okay, here's our roadmap for this structural journey. We'll be hitting the hidden drivers of health, the poverty penalty, the rise of work stress, the job strain model, the human element, and finally, connecting stress to illness. Let's dive right in.
Section 1. Hidden drivers of health. To really get this, we need to completely reframe our understanding of what makes us healthy or sick. We usually just think about genetics, diet, or maybe hitting the gym, right? But the source material paints a much broader, much more complex picture.
When you look at things like unresolved grief, poverty, or housing instability, it becomes crystal clear that our lived experiences are foundational to our physical health outcomes. These aren't just bad days or tough breaks. They are profound social and psychological determinants that directly dictate your physical and mental well-being.
Moving to Section 2, the poverty penalty. To truly grasp this impact, we have to look at the stark reality of how socioeconomic deprivation acts as this massive, heavy penalty on public health. And the data here is particularly clear when we look at cancer. The source material outlines this brutal cascade effect. It shows exactly how social determinants hit every single step of a disease. People in deprived areas have a higher prevalence of risk behaviors, and they have a lower uptake in preventive screening. This naturally leads to later diagnoses, different engagement with treatments, and ultimately far worse survival outcomes. It's wild, but your socioeconomic status literally dictates your medical trajectory.
And the numbers really back this up. Looking at a 2014 comparison between routine manual workers and managerial professionals, the contrast is just stark. Those in routine and manual jobs face massively higher practical and psychological barriers to getting medical help. They report finding it much harder just to get an appointment, and crucially, they are way more worried about quote-unquote wasting the doctor's time.
Section 3. Rise of work stress. So, if our broader environment and social standing dictate our health to this degree, we absolutely have to talk about where most of us spend our waking hours: the workplace.
First, let's define what we actually mean here. Work stress isn't just having a rough Tuesday. We're talking about specific, objective, and subjective factors in your job that generate documented biological stress reactions. The sources strongly link these high levels of work stress to cardiovascular issues, depression, anxiety, and even serious increases in workplace accidents. And you can see this massive, undeniable spike in the social surveys tracking job strain from 1992-2006. It highlights a very real, long-term trend of increasing job strain for both men and women. The modern workplace has fundamentally just become a more stressful place to be over time.
Section 4. The job strain model. Okay, to solve a problem, you got to measure it, right? So how do public health experts actually quantify a stressful job in a scientifically rigorous way?
This is where Karasek and Theorell's demand control support model, or the DCS model, comes in. Developed back in 1990, it's basically a recipe for illness. It proposes that extreme job strain occurs when you face high job demands combined with low job control and practically zero social support from your managers or colleagues.
When you map demands against control, you see that being stuck in that bottom right high-strain zone where the demands on you are sky-high but your control is practically non-existent is exactly what empirically correlates to a severe risk of physical and psychological illness. To really understand what experts mean by job control, you have to break it down into two key pieces. First is decision authority. Do you actually have the ability to choose when and how your tasks are done? And second is skill discretion. Are you allowed to use and develop your unique skills, or are you just doing endlessly boring, repetitive tasks? A lack of both is what crushes you.
Listen, if you only take away one thing from this explainer today, let it be this staggering quote from a massive study of 20,000 American nurses. They proved with empirical data that the decline in health associated with job strain was just as large as the decline from smoking and living a sedentary lifestyle. I mean, wow, a bad job can destroy your health just as effectively as a pack-a-day habit.
Section 5. The human element. But hold on.
We can't just treat stress like it's some toxic chemical leak in the office building. There's a missing variable here that completely shifts our understanding of how this actually works in the real world.
See, the DCS model has a major flaw. It's built on a traditional epidemiological approach. It basically assumes that high demands and low control are inherently pathogenic, meaning they just automatically cause disease, in the exact same way that breathing asbestos causes cancer, regardless of who you are or what you're thinking.
And this quote from Wainwright and Callan brings up the real plot twist here. The problem isn't that bad jobs don't cause illness. It's that social factors don't just magically happen to us. Our own consciousness, our individual perceptions, and our beliefs actively mediate the relationship between our work and our disease.
The human element is huge here. Psychological stress and anxiety from work only become physically embodied, presenting as measurable changes in your body through your own cognitive assessment. It requires human reflection. If you don't actually perceive a situation as a massive threat or a loss of control, your body won't react as if it's being poisoned.
Section 6. Connecting stress to illness. All right, we've zoomed in from society, down to the office matrix, and straight into the inner workings of the human mind. Now let's finally connect all these dots to see exactly how psychological stress breaks down the physical body.
There is this incredibly complex pipeline linking your social life to your illness. It's a total chain reaction. Social factors and poor work environments cause chronic stress. That mental stress drives risk behaviors, like leaning on alcohol or tobacco. That, in turn, tanks your proactive health behaviors, like actually showing up for medical screenings or sticking to your treatments. Ultimately, this constant psychological arousal suppresses your immune system and dictates your final health outcome.
To ground this in reality, the source material presents a fascinating case study of a patient named Madeline. It reminds us that a patient's entire journey through the medical system is profoundly dictated by the social factors weighing on them. Her health behaviors, her willingness to get screened, how she viewed her treatment, and her daily engagement with it. All of it was fundamentally altered by her social reality and the stress she was carrying.
And the amazing thing, patients kind of intuitively know this already. The data shows that patients actively trace their physical illnesses back to severe emotional trauma. In one really poignant study, a breast cancer survivor explicitly linked her illness to the severe emotional distress of a bitter divorce, stating about her breast, "That's why I think it affected me there." People actively recognize the links between their emotional stress and their physical disease.
Which brings us to the end of our explainer. I want to leave you with a final, really vital question. Knowing that your workplace isn't just frustrating but potentially pathogenic based on your perception of demands and control, what changes do you need to make today? Because your health is listening to absolutely everything your mind is dealing with. Thanks for hanging out with me, and keep learning.